Assalamu alaikum. Dear student, this is lecture number 3 from chapter Support and Movement, and today we will discuss topic deformities of skeleton. Human skeleton may have some deformities. What is a deformity? Deformity of a skeleton can be the malformation of bone in children, or the deformed bones become deformed after some time or in older age. Causes of deformities. There are three main causes of the deformities found in skeleton. That can be genetic disorders which are associated with deformities in skeleton, hormonal disorders or hormonal deficiencies, nutritional deficiency or malnutrition. Genetic disorder. In order to understand the genetic disorders association with the deformity of the skeleton, we will discuss these three conditions, that is cleft palate, microcephaly and osteoarthritis. What is palate? Palate is the roof of our mouth. We have a thin layer in our mouth which separates the cavity of the mouth from the cavity of the nose. In normal conditions, the children in normal condition by birth have this layer, but in few children this layer is not fully developed and there is a hole between the both cavities of the mouth and of the nose. As this condition is congenital, which means this deformity is present by birth. But in microcephaly, what is microcephaly? Micro means small, cephaly means head. In microcephaly, children may have a small size of head rather than the expected normal size of the head by their birth, or they maybe develop it in first few years of their life. So this condition can be by birth, or the children may have inherited the tendency of this deformity. So there are two main type of genetic disorders. They can be by birth, that is congenital, or the tendency inherited by the persons of that particular deformity, right? Osteoarthritis. Osteo means bone, arthritis means swelling in the joint. When the bones of the joints are swelled, they are painful and hard. That's why the movement of that particular joint is not easy or maybe immovable. This condition can be seen in elderly people or adults. Hormonal disorders. This deformity caused by the hormonal deficiency. Example is osteoporosis. Remember, osteoarthritis is the example of genetic disorder, while the osteoporosis is the example of hormonal disorder. Osteoporosis, osteo means bones, porosis came from the word porous. Porous means holes. So the bones become porous, or holes are present in the bones. This condition is more commonly seen in elderly women. Why? Because the secretion of hormone estrogen decreases with the increase in age. And this hormone estrogen, when the secretion of estrogen is decreased, the bones of that person becomes porous, thin, weak, and can be very easily breakable. This deficiency of the hormone of estrogen can affect most of the bones of our body, but especially the bones of hip, vertebrae and wrist are prone to fractures. They can very easily fractured if the person falls down or get hit at the hip, vertebrae or wrist. Nutritional deficiency or malnutrition. General deficiency of nutrition can make our bone weak. If we talk about minerals like calcium and phosphorus, if we have deficiency of calcium and phosphorus in our diet, it can result in softer bones and deformed bones. The person with such deficiency, it means deficiency of calcium and phosphorus, become incapable of bearing its own weight. Particularly talking about the deficiency of vitamin D can cause rickets. Rickets is the disorder observed in children. We have discussed about the importance of vitamin D in our previous lecture, that vitamin D is very essential for absorption of calcium. Without vitamin D, calcium cannot be absorbed in our body. So when the vitamin D is deficient in the body, it will decrease the absorption of calcium, and because of the decrease of calcium, the bones become soft and deformed. The example can be seen in children with bowed legs or the bended legs. Here we will discuss the common diseases of the skeleton. We have discussed the causes of these diseases, but now the common diseases or deformities of the skeleton. First one is disc slip. What is disc? Our vertebrae present in vertebral column have intervertebral discs between them, which act as shock absorbers. When we walk, run or jump, these discs bear the shock and helps the vertebrae to move easily. Discs present in the vertebrae have two parts: the inner soft jelly-like part, which helps in the mobility or movement, and the outer strong and cartilaginous part, which holds the vertebrae together. When the cartilaginous part of this disc ruptures or displaces, it basically exert pressure on the spinal nerve, which is going through the vertebrae or vertebral column, and it results in the severe pain and inability to move. When the disc is slipped, it will exert pressure on the nerve, and nerves, whenever the area or the affected area near nerve near nerve will cause severe pain, and because of that pain we cannot move. What is the cause of this condition? It can be physical trauma, like if the person falls down, or some kind of accident can cause this slip. Treatment: prolonged rest on hard bed, and painkillers will help in managing the pain. Second, spondylosis. This condition or deformity is it involves the joints which are present between two vertebrae, particularly of neck. In this condition, the vertebrae present in our neck have deformity, or the condition in which the space between these two vertebrae present in the neck narrows down, which means vertebrae come closer to each other as compared to the normal space of it, which causes again the pressure on the nerves coming from the spinal cord. Spinal cord is going through the vertebral column, so it will pass through the neck also, and when the vertebrae narrows down or come closer, they will exert pressure on the spinal cord, which results in the pain in neck, shoulder and upper limb, which means arms. As the neck is joined with the shoulder and arm, upper limbs or arm, so when the pain occurs in neck, it will involve shoulder and the arms also. What is the cause? Normally this condition is observed in aged people. Treatment: the hard collar is used around the neck, which normally supports the vertebrae to stay a little bit apart from each other, so that they don't press the nerve and causes the pain in the neck. Arthritis. As I have told you, arthritis is the swelling in the joint. So this condition involves the joint of our body which becomes swollen, painful and immovable. When the swelling occurs, it is painful, and whenever there is a pain, we cannot move that part very easily. We have discussed that the cartilages are smooth and flexible in our previous lectures. These smooth and flexible cartilages are present in between bones of a joint. We have discussed that earlier as well. So, when these flexible, smooth cartilages present in the bones of a joint denatured by the deposition of calcium, as these cartilages are smooth and flexible and soft, but when the calcium is deposited on this cartilages present in the joint, it will be hard. It will make that cartilage hard, and because of that condition, joint becomes very stiff and hard to move. What are the causes? It can be because of the inheritance. It can be inherited, any kind of viral infection or injury, and aging is one more factor. In aged people, we have seen this condition very oftenly. Treatment, replacement, the only remedy for this condition or arthritis of the joint is the replacement of affected joint by an artificial joint. An artificial joint can be made up of rubber or plastic. Sciatica, in this condition, severe pain of hind limb occurs. Why? Because the any kind of condition such as disc slip, we have discussed disc slip. If this slip happens in the lower abdomen, then it will involve the legs also. There are nerves passing through that area which are called as sciatic plexus. The nerve, when the nerve of sciatic plexus is being pressed because of this slip, it will cause severe pain in the legs, and this painful condition of leg makes it almost immovable. When this condition occurs, person cannot move its leg very easily. What are the causes? This slip, as I discussed earlier. Trauma, again any kind of injury or trauma, or if the branch of sciatic nerve is damaged, it will cause again the same condition. As it will involve the nerve, it will cause pain, and when there is a pain, we cannot move that particular part. Treatment, its treatment is very slow, or maybe the recovery will be incomplete. Okay, these were the common diseases of the deformities or of skeleton. Now this is a topic which includes the repairment of a bone. If a bone is broken, how it is repaired? We know that bones are strong and hard, but they may sometimes break because of the trauma or old age. As in old age, bones become weak, so they can easily breakable. Broken bone is called as fractured bone. We know that bones are made up of living tissues. We have discussed it earlier. And whenever the bones are broken, they start healing like other living tissues of the body. Fracture. What happens when the fracture occurs? When the fracture occurs, doctor only fix bone with or without surgery in its normal position. Doctor have to fix the bone in its normal position, while rest of the healing process will occur by its own self. If we talk about the compound fracture, what is compound fracture? The fracture which involves the wound or injury on the skin also. In some fractures, there is no wound, only the bone is broken inside your body. So it is normal fracture, simple fracture. But what is compound fracture? When the broken bones also involves the wound on the skin. This is called as compound fracture. What happens when the compound fracture occurs? The broken bone is realigned. It will be realigned by the help of steel screws or rods or plates, steel plates or steel rods. After realigning, it will be wrapped into plaster by using plaster of Paris to make that affected area immovable for a few weeks. In this way, bones are held together under stress by the plaster so that healing takes place in the right direction. When the bones or affected broken bone kept in the right place and kept held with the help of the plaster for few weeks, it will allow bone to heal in the right direction.